Percutaneous laser disc decompression and endoscopic discectomy are two common advanced techniques. While both aim to reduce your pain and help you avoid major open surgery, they are very different in how they treat the disc. Think of it this way. Percutaneous laser disc decompression is an indirect treatment that shrinks the disc, while endoscopic discectomy is a direct surgery that removes the herniated fragment. Percutaneous laser disc decompression is one of the least invasive treatments for a spinal disc problem, using a laser beam delivered through a needle. The term percutaneous means through the skin. During percutaneous laser disc decompression, the procedure is performed using only a local anesthetic to numb the skin and surrounding area. The surgeon uses live X-ray guidance, or fluoroscopy, to insert a thin needle into the center of the herniated disc, so-called nucleus pulposus. A laser fiber is then threaded through this needle. The laser is activated to vaporize a tiny amount of the water-rich material inside the disc's core. This vaporization causes the pressure inside the disc to drop dramatically. The goal is for this pressure reduction to create a vacuum effect, which then draws the bulging disc material away from the compressed nerve root, relieving your pain. This procedure is considered best for patients with small, contained disc bulges, where the outer layer of the disc is still intact. The main pros of percutaneous laser disc decompression are that it is exceptionally minimally invasive, requiring only a needle puncture with no incision or stitches. It also uses only local anesthesia and has the fastest recovery time, often allowing a quick return to activity. However, there are significant cons, as this is an indirect procedure that doesn't actually remove the herniated fragment. Because of this, its success rate is lower and less predictable. Furthermore, percutaneous laser disc decompression is not an appropriate treatment if the herniation is large or if a fragment has broken off or sequestrated.
Endoscopic discectomy is an advanced, modern surgical technique that is part of the broader category of minimally invasive spine surgery. This procedure is performed through a small incision, typically about 8 to 10 millimeters long. The term endoscopic means the surgeon uses an endoscope, a thin tube equipped with a high-definition camera and a light source. The surgeon inserts the endoscope through a working channel and guides it to the precise location of the disc herniation, gently moving muscle tissue aside. The camera provides a close-up, magnified view of the spine on a screen. This allows the surgeon to perform a direct decompression. They can see the nerve root and the disc fragment causing the compression and use specialized instruments to physically remove the herniated piece. Because the nerve is seen directly, the removal is highly precise. An endoscopic discectomy is best for nearly all types of disc herniations, including large protrusions, extrusions, or fragments that have broken off, and cases that have failed non-surgical treatments. The pros of this procedure are its high success rate and the fact that the herniated fragment is directly removed under visualization, which immediately frees the nerve. It also involves minimal damage to the surrounding muscles, resulting in less post-operative pain and a faster recovery compared to older surgical methods. The main cons are that it is a more invasive procedure than percutaneous laser disc decompression, as it requires a small incision and may involve local with sedation or general anesthesia. These procedures were developed to treat disc pain with less damage than traditional open surgery. Percutaneous laser disc decompression came first. It was pioneered by Dr. Daniel S.J. Choi, USA,
and performed on the first human patient in 1986 in Graz, Austria, with Dr. Peter Ascher. The goal was to use a laser as a no-scalpel tool to indirectly shrink the disc by vaporizing its core. It was quickly adopted by other European innovators like Dr. W.E. Siebert in Germany. Endoscopic discectomy evolved in the 1990s and 2000s to solve percutaneous laser disc decompression's main drawback, its blind, indirect nature. Pioneers like Dr. Anthony Young, USA, and Dr. Sang-Ho Lee, South Korea, developed methods to use a tiny camera or endoscope to directly see and physically remove the herniated fragment. This approach was refined and advanced by many surgeons in Europe, including Dr. Thomas Hoagland, Germany, Dr. Peter Van Dale, Belgium, and Mr. Mo Akmal, UK. The ultimate measure of any procedure is its long-term success. Endoscopic discectomy has a high success rate, often 85 to 95%, and a low reoperation rate. Because the surgeon removes the offending disc fragment directly while watching the nerve on a monitor, the chance of immediate, successful pain relief is high. Percutaneous laser disc decompression, while less invasive, is less reliable. Studies show a lower success rate, often 60 to 70%, and patients who do not achieve success often need a second, more effective procedure, like an endoscopic discectomy, later on. The reoperation rate for percutaneous laser disc decompression is significantly higher than that for endoscopic discectomy. In summary, endoscopic discectomy is a direct, visible, and highly reliable method of surgically treating most herniated discs, while percutaneous laser disc decompression is a blind, indirect, and more limited method best suited only for the smallest and mildest cases.